Well, the quickest way to solve all of the uncertainty in the healthcare sector? Give states maximum flexibility. That's according to economist Stuart Butler of the Heritage Foundation. Dr. Butler, thanks for being here.
My pleasure.
Well, is that realistic? How easy or difficult would that be?
Well, I mean, let's face it, it's happening already. States are already the ones that have been in the lead for many years in terms of looking at insurance changes, dealing with Medicaid, and so on. So we have a long history in America under our federal system of the states taking the lead in a lot of areas. It's also a huge country, and trying to think about how you would get an identical health system in Lower Manhattan or in Wyoming and so on with its huge differences, I think is a challenge. So what I really favor is saying, let's agree broadly as a nation on sort of what our outcomes are we want. What is it the general goal that we want? And then allow states maximum discretion and flexibility on how to achieve those stated goals. So I don't think it's a kind of a way of saying let states do whatever they want. It's more a question of saying that it's really hard to think about how you would make a system work everywhere. So let's have the states try out the best way they can of reaching the goals that we broadly agree on.
So would states welcome this, or would they be looking at fewer federal dollars to support that kind of system?
Well, I think I think the dollars that are currently spent at federal level, or whatever we agree to spend as a nation, we make sure that if the states are moving forward rather than the federal government, then that money is transferred in some way. So, for example, Medicaid, if you wanted to let Medicaid be a much more innovative program, well, then give the states the federal share with strings attached, with some clear agreement about what they're going to do and whether it meets the objectives of the Medicaid program. So the money would follow to the states, would go to the states in that case. So I think that's really how we did welfare reform, for example, back in the 1990s. We said this is basically the outcomes we're looking for, and we allowed the states to decide how really to do that. There's got to be agreement between the federal government and the states, and I think that's the key. Let them handle the money and let them have control over it.
Okay, and are we finding that people can't be in agreement with this, so that's why we're not seeing more progress 12 months out from when we passed the law?
Well, there's a lot of disagreement, isn't there, about the law. There's philosophical disagreement, of course. There's disagreements about key parts of it. And there's also, at a more practical level, the argument that in particular situations or particular states, it won't work the way that advocates said it would. Or some cases, states already been doing something or going down a direction. And they say, this is the direction we would really prefer to go in, rather than what this law now tells us we've got to do. So I think there's not just opportunity, I think it makes sense to say, let's see if we can negotiate with the states and say, if you've got a better way of reaching the general objectives of greater coverage at an affordable cost to governments at all levels and to the individual person living in the states, then we're open to doing that.
So ideally, what do you think would really work? You've worked out the numbers yourself, I assume.
I think yes, and I think really the area that it's most important to move forward on is actually insurance reform. I think that we really don't know, to be perfectly frank, in Washington, although I've lived in Washington for 30 years, it's the dirty little secret is that Washington actually doesn't know best. Despite analysts like myself and others working on this, nobody's really that confident that they can figure out how to get a structural change of insurance to really work as advertised. So I think it makes a lot more sense to say, look, these are the parameters. These are the things that we really want to make sure happens, that everybody gets a premium that is at least affordable. But the range of premiums between sicker and healthier people, while it's got to be reasonable, we're not sure exactly what the right differences are. So let states try that out. Let states look at how they integrate insurance reform into what they're trying to do. So I think that's the most productive area right now. I think the money is really the subsidies that are available. And I think that that's in large part dependent upon what the federal budget looks like. We've got huge deficits. We've got to make some decisions over the long term about what degree of subsidy there's going to be into healthcare and how we do that. But I think allowing states to figure out the best way to organize their health system, and particularly the insurance system, is the right place to let states take the lead. Let the federal government make decisions about what is reasonable, what's a reasonable cost and burden for people to pay for health care, and what is the basic quality of health care that is acceptable in the United States of America. That, I think, is a national decision. Mm-hmm. But how we actually do it, I think we've learned very effectively how states can be very creative in figuring out how to do that.
Absolutely. All right, Dr. Butler, thank you very much. And thank you for letting us in on the secret. I'm Mabel Jung at the World Healthcare Congress in Washington, D.C.